This MCQ is a translation of question number 2 of the official Italian medical specialization exam that took place in 2024. A 20-year-old man arrives at the ER after a fall from his motorbike. He presents with a large ecchymosis of the left hemithorax and dyspnea. Which of the following diagnoses is the most likely? Alright, pause the video if you need to. Let's get through these by process of elimination. Answer A. Pulmonary emphysema. Well, it's usually a chronic condition that's associated with obstructive lung disease, not an acute trauma. Therefore, we'll just cross it out. Answer B. Vertebral fracture. Well, that may cause back pain, but it's not directly related to dyspnea and also not to extensive hemithoracic ecchymosis. Answer C, pneumothorax, that's valid, but let's go forward. Answer D, bronchopneumonia. Well, that's less likely in the absence of previous respiratory symptoms and also in the absence of a clinical picture of infection. In this case, no parameters were given. It was not mentioned that the patient had fever or low blood pressure, tachycardia, what you would expect in a clinical picture of infection or sepsis. Lastly, we have answer E, pericarditis, so an inflammation of the pericardium. Well, that's more often associated with infection or other systemic diseases rather than chest trauma itself. So we find ourselves at answer C. Not only by process of elimination, of course, but also, the question is, although it's a state exam question, it's quite easy, meaning that you wouldn't necessarily need to do the whole process of elimination, but for the sake of drilling this way of approaching all of these questions, irregardless of difficulty, I am obliged to show you the standard way of thinking about these. So please, do forgive me if at times I may seem a bit pedantic. So to recap, the answer is pneumothorax, which, as you may know, is a condition in which air enters the pleural space, causing the lung to collapse. Alright, next, for practice purposes, I have prepared a mock MCQ question similar to the exam format that you would find in the official exam. A 37-year-old man arrives at the ER after a fall from his motorbike. He presents with extensive ecchymoses of the left hemithorax, dyspnea, and a reduction in breath sounds upon auscultation of the left hemithorax. A chest x-ray shows deviation of the trachea to the right and increased lucency of the left lung field. Which of the following is the most appropriate step in initial management? A. Administration of 100% oxygen and clinical observation, followed by another x-ray after 24 hours. B. Immediate thoracentesis, followed by insertion of a chest tube. That sounds about right. Next one. C. Intubation and mechanical ventilation with continuous positive airway pressure. D. Broad-spectrum antibiotic therapy and chest drainage only if indicated. Lastly, E. CT scan of the chest to assess the need for surgery. Well, I think you got it by now. The answer is B. The clinical and radiographic findings are suggestive of a tension pneumothorax, which, as we said, it's where air progressively accumulates in the pleural space. It compresses the lung and displaces all the mediastinal structures, such as the trachea, contralaterally, right, to the opposite side. Of course, this is an emergency situation. It requires immediate action to relieve this pressure. So, obviously, a thoracentesis followed by insertion of a chest tube, as described in answer B, would be the most appropriate step in managing and decompressing the pneumothorax to stabilize the patient. The other options, such as oxygen administration without drainage or intubation without immediate decompression, or just simple observation or whatnot, they're just not appropriate in the case of a tension pneumothorax because this will just delay life-saving treatment.